Okay, welcome everybody to this special session today. It is a joint session of the Life Science project together with the ENLIGHT project, both addressing the internationalizations of our study programs in the broader sense. Today's title is Health and Sustainability, and we have a tough program today covering 4 talks. And I give the introduction of each speaker after one another. And today, Mats Målqvist from the University of Uppsala will start with his presentation about health, sustainability, and transformation. Mats gives the second presentation in the frame of the ENLIGHT project in this sessions today. He is Professor of Global Health at the Department of Women's and Children's Health at Uppsala in Sweden. And currently he is Director of SWEDESD, if I'm right, Sustainability, Learning and Research Center. And Professor Målqvist is a medical doctor by profession. So this is not in the stronger focus of our current liveSciences project, but he is dealing with the health and health equity, which is his core of his research and his educational activities. And Mats will start with his presentation, and I would like to cordially welcome you that you were ready to give your presentation, and I hand over to you, Mats, and the audience is yours. Thank you very much for participation a second time.
Thank you so much for that kind introduction. Yes, I will now share my screen, and I hope that you can see it here now. Good. So, yes, thank you for inviting me back. I had a lecture or a mini lecture here in October on a similar topic, so I hope I won't repeat myself too much. The title of my speech today is Health, Sustainability and Transformation, a New Narrative for Global Health. And this is based on a recently published editorial in BMJ Global Health that I and a colleague of mine have written, where we outline, as the title states here, a new narrative or suggests a new narrative for global health that also includes sustainability. For that, I will want to go back a little bit in history and see where are we coming from, because sustainability, as you know, is well, maybe not a new concept, but it's talked about in a new way, and it's kind of a buzzword these days. So how does it sit within the historical context of ideas, if you like? And if we start with health on the global arena, how has it been discussed and approached over the years? Well, you could quickly or very roughly divide it into public health, international health, and now global health. And even before these 3 topic domains, so to say, we had tropical medicine, where it all kind of originated. And tropical medicine was the discipline where the colonizers going from Europe, going out to the big world, to Africa, Asia, encountered new and exotic diseases, and they wanted to understand how they could keep the troops and the staff healthy. That was the focus of tropical medicine. Later, in around 1920s, we had public health emerging. And public health was part of the nation-state building projects, you could say, where focus was at population levels within countries, within nation-states in Europe. And public health was defined in the 1920s as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society's organizations, public and private communities and individuals. what we today know as public health, a discipline that still exists at many universities, and it's a major discipline within the health sector all around the globe. But tropical medicine, on the other hand, was after the Second World War and the liberation of the former colonies transformed into international health, where the focus became on public health somewhere else, you could say, where medical professionals and public health professionals in the richer parts of the world, in Europe and later also in the US, got educated in order to go to low and middle income countries or low resource settings at that time to take care of the health problems in these settings. It was very much a bipolar world of those who had and those who had not. A world order that still remains in words like developed and developing countries, that now is more or less being abandoned. The Lancet, for example, for some years ago said that they would stop using those terms, but it still is around and is reflecting a world order which was bipolar, which was the rich and poor, developing and developed. This situation has over the years developed because of socioeconomic development in the world, and today the world is more of one world, and most of the populations live in middle-income countries. 70% of the world's population live in middle-income settings, and that has given rise to a new topic which we call global health. And since about 2008, when the Commission on the Social Determinants of Health came with a report, we had a big financial crisis that emphasized the oneness and the interconnectedness of the world. We also had, we were halfway through the Millennium Development Goals, which were very much derived from an international health agenda with a focus on the poor countries trying to improve their health outcomes. It was more and more acknowledged that we cannot no longer have this division of the world. We need to address the health of the global populations from one perspective, that we are in this together. And then global health emerged and was defined by Copeland et al. And there are many different definitions, but Copeland's definition has gained most traction. It was launched in 2009, about the same time, saying that global health is the health of population in a global context that transcends the perspectives and concerns of individual nations. So coming away from public health to global health, that these transnational health threats. A lot of focus was also put on the inequities of health, and that the inequities prevail not only between countries, but also within countries, within almost all settings. And that inequities is very important to mitigate in order to have social sustainability and good societies that could work effectively together. So that's basically where global health is today, very short and very briefly. The transnational health threats and the equity focus on health. And then this talk was about health and sustainability. So where are we on sustainability? Well, there are different kinds of narratives, and this I discussed in the previous talk. And one that has gained most traction and that is most often referred to when we talk about sustainability is the narrative about planetary boundaries. That we have a certain space, so to say, within the nature, within the planet, where we can operate in order to not overuse natural resources, not strain the ecosystem. So this narrative is very dominant within the natural sciences, for example. It's a natural science paradigm, more or less. There's been attempts to kind of modify this planetary boundary perspective. One is Rowart's donut model, which also takes into account the social dimensions of sustainability, and that we need to have sustainable social societies that are effective and are not collapsing. So this brings us a little bit closer to the connection between health and sustainability, because it also includes social health aspects. A third narrative is the three dimensions of sustainability, where ecological domain is one, the planetary boundary domain, and then we have the social domain, but also economic and political aspects of sustainability. So different ways of looking at sustainability that more or less are accounting for also health of populations. In the Sustainable Development Goals, we have number 3, health being one out of many. That's one relation between health and sustainability. But we also know that the SDGs have a lot of interactions. There are synergies and counter effects, both negative and positive interactions within these that could be pictured in different ways. But WHO puts health in the middle of the sustainability narrative and says that health is the foundation and also the purpose of all discussions around sustainability. This is very much an anthropocentric perspective, but it somehow brings together health on a global arena together with the sustainability narrative. In our editorial, we want now to build another narrative that takes these two perspectives together, bring them together. And that can be done through the concept of the sustainability quadrant. In this graph, we have on the y-axis our ecological footprint, the planetary boundaries, if you like, how much resources different countries, all these dots are representing different countries, how much resources are used. And on the x-axis, we have health, here represented by Human Development Index, depending on how you define health. But if you define health as the possibility to develop and thrive, not only surviving, Human Development Index is a good indicator for that. And what we see here, if we put these two together, the health and sustainability together, we see that there is a very strong correlation, that if health improves with the use of resources or ecological footprint, if you like. And this is now the challenge for global health. Traditionally, global health has wanted to push everyone towards the right corner of human development. And that is then included in the equity perspective, in the international health perspective, even in the public health and to a certain extent, the tropical medicine perspective. But we also know that we cannot sustain this. We have to do this at the same time as we reduce our carbon footprint, our ecological footprint. And this is now the challenge that might be the new narrative of global health, that health is an integral part of sustainability agenda. But how will we do this? Well, this is tricky because this is basically a wicked problem. This is a problem that cannot actually really be solved without us transforming, finding new ways. So there's also a very much a need for a transformation in this agenda. The need to do things in new ways and to challenge structures, which we have inherently in the equity perspective of global health. To challenge the inequities and things that are the way we're doing things today. And in order to do this, we also need to imagine a different future. So to conclude this very short and brief time span, health and sustainability are interconnected. But in order to meet the challenge to have a sustainable world where everyone can thrive and not only survive, we need transformation. We need to find new ways for this way forward. Thank you so much.
Okay, thank you very much, Mats, for this compact presentation. So I would like to continue to our second speaker, Anjali Purushottam, if I'm right. She is currently a postdoc at the Department of Agricultural Economics and Rural Development at our university here in Göttingen. Her talk will deal with the subject on double burden of malnutrition in peri-urban Bangalore in India. And in her research, she concentrates on food systems transformation, nutrition transition, and public health and rural transformation. Anja, I hand over to your presentation. Thank you very much for coming and participation. So we have special issues on the overview, which just Mats have given.
Can you see my screen?
Yes, okay.
Okay, yeah, thank you. Thank you for the introduction. Good evening, everyone. It's wonderful to be talking about some of my work here in this lecture series today. My presentation is about the status of double burden of malnutrition in peri-urban regions of Bangalore in India. Unlike the previous presentation, which gave the overview of the status of global health, I am now talking about more of micro perspective of the health of individuals and households in certain regions in low and middle income countries. This is a joint work done in collaboration with my colleagues, Nitya Mittal, Stefan von Kramen-Taubadel, and Sebastian Vollmer. I will start my talk by briefly introducing you to the concept of the double burden of malnutrition and talk a bit about what drives this particular health challenge. And after that, I will show some empirical evidence on the prevalence of double burden of malnutrition in peri-urban regions of Bangalore, and finish by talking about how this double burden of malnutrition can be addressed. So to start with, undernutrition and overnutrition have typically been studied and researched as separate challenges. Due to this, they have been considered to affect different populations and pose contrasting risk factors to the said populations. On one hand, undernutrition was linked with poverty, food insecurity, and infection, whereas overnutrition was linked with affluence, excess intake of certain food items, engagement in sedentary behaviors, and the resulting imbalances in energy consumption and expenditure. However, the new reality of nutrition and health status, particularly in many low and middle income countries, is the coexistence of undernutrition and overnutrition problems. And this is called the double burden of malnutrition. And this double burden of malnutrition can occur or exist within communities or populations, within households, and even within individuals at any given point of time, or even over the life course of an individual. Let us see what the drivers of this double burden of malnutrition are. The drivers of double burden of malnutrition include a sequence of transition processes. The first among these transition processes is the nutrition transition, which describes the shift in dietary patterns, consumption, and energy expenditure associated with economic development over time, often in the context of globalization and urbanization. This nutrition transition indicates an increased intake of energy-dense food items and a decreased physical activity levels among people, which leads to imbalances in energy intake and expenditure. And such imbalances in energy intake and expenditure are associated with this shift from the predominance of populations with higher rates of undernutrition towards higher rates of overweight or obesity prevalences. The second driver of double burden of malnutrition is the epidemiological transition. This describes the changes in overall population disease burden associated with the economic growth, which means that there would be a shift from the predominance of infection and diseases related to undernutrition to the rising rates of non-communicable diseases such as diabetes, high cholesterol, hypertension, etc. And the final driver of DBM, or the double burden of malnutrition, is the demographic transition. This describes the shift in population structure and lengthening lifespans. That means the transformations from populations with high birth and death rates consisting of relatively younger population towards increasing proportion of older people in the population, who are also more likely to face face the non-communicable diseases problem as they age. And in high-income countries, these three transition processes, such as the nutrition, epidemiological, and demographic transitions, have occurred slowly and in mostly near linear fashion in the last 2 centuries. And this has resulted in the intergenerational, incremental, and controlled increases in population height, weight, and lifespans in high-income countries. Whereas in many low and particularly in middle-income countries, these three transitions have been accelerated. That means the transitions that took 2 centuries to happen in high-income countries are occurring over a few decades in low and middle-income countries. And this has resulted in intragenerational changes in dietary patterns, nutrition, and health status, leading to the coexistence of undernutrition and overnutrition, which in other words called as the double burden of malnutrition. With this background, my colleagues and we conducted a primary socioeconomic survey to estimate the prevalence of the double burden of malnutrition in peri-urban regions of Bangalore. Bangalore, as you can see from this figure here, is the rapidly growing megacity in southern India. The peri-urban areas of Bangalore represents the regions that span from the outer peripheries of Bangalore city towards the traditionally defined rural areas. And these peri-urban regions exhibit the characteristic of both rural and urban areas, and due to their dynamic environment, they're most likely to experience the faster pace in the nutrition, epidemiological, and demographic transition that I discussed a while ago, and thus are more likely to face the problems of double burden of malnutrition. And we particularly focus on these peri-urban regions in the northern and southern part of the Bangalore city. And in this region, a survey of 955 households was conducted between March and August this year. In this table, I show the prevalence of different indicators of undernutrition and different indicators of overnutrition. Firstly, in separate ways, and in this last column, I show their coexistence in the form of double burden of malnutrition. And I showed these prevalence rates for 4 demographic groups, such as women, men, adolescents aged 5 to 18 years, children aged below 5 years. And these demographic groups are the respondents who are living in the 955 households that we surveyed in Bangalore region. From this table, we can see that in the realms of undernutrition, between 11 to 18% of the sample is affected by underweight problem, which actually in comparison to the national level statistics or even the state level statistics, these prevalence rates are very low. Whereas anemia is a severe health problem among all 4 different demographic groups. And if we come to the overnutrition indicators, obesity is a major concern, firstly among women, followed by men. And if we see the obesity prevalence among adult population in Bangalore region, the prevalence of obesity or overweight or obesity is almost approximately 4 times higher than the prevalence of underweight problems among the same adult population in this Bangalore region. And in addition, diabetes and hypertension have higher prevalence among men, whereas the higher cholesterol is a significant health risk among women, followed by men. And furthermore, we can see that a fair number of people in our sample in this region of Bangalore have the double burden of malnutrition, which is defined as an individual having either form of this undernutrition and either of these overnutrition problems. And we can see that 46% of women that we surveyed in this region have the problem of coexistence undernutrition and overnutrition at the same time. And 32% men and 15% adolescents also have the double burden of malnutrition prevalence in Bangalore. And this indicates that health problems in Bangalore are multifaceted and one cannot be addressed ignoring the other. And to conclude, double burden of malnutrition is the new reality of nutrition and health status in peri-urban regions of Bangalore. In addition, the severity of double burden of malnutrition in Bangalore is very high compared to other regions of India, as shown by very few studies conducted on this topic in India. And this calls for policymakers and governments to consider the double duty action frameworks to address the double burden of malnutrition. These double duty actions are the interventions, programs, and policies that simultaneously aim to prevent or reduce the risk of both undernutrition and overnutrition. And this is it from my side. And if you're interested in knowing more about this topic, and these are some of the references. Thank you.
Okay, thank you very much, Anjali. I guess in the discussion later on, we will have some interesting connection between your presentation and the presentation of Professor Målqvist with respect to the demographic transition on the one hand and malnutrition on the other hand. So yeah. I'm excited to hear the discussion later on. But before we come to this point, I would like to hand over the micro to Charlotte Scherens from the University of Ghent. She will give a presentation about the impact of the climate-induced floods last year in Belgium and its effects on health. Interesting subject, but some words to her person. She is a health sociologist and postdoctoral researcher with a main focus area and on the intersection between environmental health and health equity. So health equity is also addressing in her presentation. She is operational manager of the Climate Change, Migration and Healthcare Network and is based in the Department of Economics at the University of Ghent. So Charlotte, please, now it's the audience is yours. We are avid listeners. Thank you for participation.
Thank you so much, Steve, for the kind introduction, and thank you for giving me the opportunity to present some of our work. I will start by sharing my screen. Let me see. Okay. Okay, can everybody see this?
Yes.
Okay,
Fine.
great. Thank you so much. So, excuse me, a little bit more background here about myself. So indeed, I coordinate a research network named Climate Health. I'll tell you a little bit about this in the next slides. But basically, we're based at Ghent University. That's also where that's my affiliated institution. And we're working on research, education, and public awareness on the intersection of climate change, migration patterns, and the impact on health, and also how health services can be adapted to the impact of climate change, and also can be more climate sustainable in order to help with mitigation efforts. And so one of the projects that I'm involved in, together with you and you, Chris, you and you, Merit, you and you, EHS, is on a study that we are currently still doing. So I'm sharing some preliminary results and doing an analysis on the floods that ravaged through Western Europe in last year's summer. And we looked at the psychosocial health impact, but also what the psychosocial response has been in these affected areas. And I will share some of the insights from Belgium, but similar exercises have been done in the regions affected in Germany and in the Netherlands. So this is an international project. Feel free to look on their websites for more information. And so a very short little bit about our network. So it's more and more we see quite an interaction, I would say, between migration patterns and the impacts of climate change. We know many people are displaced, are migrating either voluntary or involuntary due to climatic pressures, and or are sometimes even trapped in their houses or in their regions as well, related to climate change. And so with the network, we look at how these dynamics are seen in different regions in the world, and also what health impacts are of affected communities. And eventually we try to build towards more resilient health systems that are both migrant inclusive and climate resilience. And so on the website, you can have a look, and we do have a healthcare stream that focuses particularly on the impacts of psychosocial health, as we know that this is an under-researched area in the whole field of climate change and health. So we want to particularly focus on this in the upcoming years. But we're also looking at primary care and the interaction with public health responses and intersectoral approaches, which means that we want to see which sectors beyond the health sector should try to work together more to tackle some of the very complex issues that we see that are related with climate change. And so a little bit of background information about the psychosocial impact related also to floods, which was the particular focus of this study here. And here you can see a few of the primary stressors that have been indicated and have been identified, in research, which is divided into primary stressors, which is really about how people experience floods, but also in like secondary stressors, which has more to do with administrative burdens, such as taking care of insurances, but also cleaning. And there's often a very lengthy recovery period, because floods are a sudden onset climatic hazard. So the damage is often, it's very direct, but often very highly impactful. And then we see the psychosocial impact has been estimated by one author as about 80% of estimated DALYs. And then there's a few new concepts that kind of have reached the literature related to specifically climate change, and they are coined, for example, climate grief, eco-anxiety, which is, those are concepts that that researchers and practitioners now see, for example, eco-anxiety has to do with the fact that we see especially young people displaying symptoms of anxiety, low mood, even depression when they think about climate change and what the impact of climate change could have on themselves and on their communities in the future, which gives them a feeling of unease. And climate grief also has to do with the fact that there's that you see people grieving in a sense about the impacts that climate change have had on their own environment, whether that is their own small community or more like on a meta level on what is happening in the world. And so we wanted to take this into account a little bit in the case study that we had here on the floods, and then also look at how emergency planning is organized for impacted citizens. And I'll have to go a little bit faster through my presentation, but here you see a little map of how the floods ravaged through the south of Belgium. And the way this is connected to climate change is because floods are said to be intensified if climate change slows the jet stream, which are the high altitude winds circling the northern hemisphere, where Europe is based, the western part of Europe, causing drenching rainstorms to linger longer over flood-prone landscapes. And we see there's the indications that this will aggravate or maybe also increase in frequency, which also has to do with longer periods of drought. So when we see drought, there might be either at one point a sudden, they would call them more flash floods, but suddenly like a very exceptional amount of rain would fall in a very short amount of time, or we would just have very extended periods of no rain at all. And then so in 2021, we had the floods. And so here you see some bits about our methods. So we, as I said, we wanted to see what are the main psychosocial impacts, how was the response organized, and what are a few challenges that were observed and future opportunities to better support affected communities. So we did this with an interview study of one of the affected communities. In this case, it was Pepinster, and using thematic analysis and inductive approach to analyze the data. And so very quickly here you can see it was quite a challenge to actually get the information about how an emergency response is organized in this context. But here you see a little bit where all the different disciplines kind of were interacting. I'm not going to go through this in detail, but this is basically an integrated emergency and interventional plan that kind of connects federal, provincial, and local levels. And it's one of the focus areas, the psychosocial intervention plan, as being part of a broader medical intervention plan. And so here you see all the arrows in red are the persons that we interviewed. So we went from the federal level, interviewing the psychosocial manager, up to the local level, looking at involved GPs, psychologists, and also had some interviews with affected citizens. And this is a little bit an overview of the results that we saw or that we observed that could be related to what they coined the acute phase. So, and here also comes the bit about migration in there, because there were quite some people that were trapped inside their houses for more than 48 hours. They were quite exposed to the floods, and they had no medication delivery possible. There was no access by first responders in this critical phase, and about 700 people could be evacuated by boat. And so we, in the corner, you can see a little bit the timeline, but then in the other side of the slide, you can see what the main psychosocial impacts were that were mentioned and observed. And so this really went from, for example, exacerbation of alcohol and substance use. And these are bits that also tie up to health equity, because we know that in the valley of these of the Vester, the people that were living closer to the river, and they already have more, the socioeconomic background was also lower. They already have lesser means to adapt anyhow, and so they were impacted the most because I would say houses from more wealthier layers in society, wealthier citizens, are all higher up, and they were not that much affected by the floods. And so we also see that there's quite some coping mechanisms already in these regions, such as a lot of alcohol and substance use. And for example, to give a very concrete example, many of those need chronic medication, and it was very challenging for the health workers to reach them, those people who were trapped inside their houses, to be able to provide medication if needed. So those were all like quite a lot of challenges that they were posed with. And then in other areas, there was also a lot of anxiety, how they would get out of their house. The health workers were really exhausted, stress, sleep deprivation, feelings of despair, panic, and isolation, which was also elevated by COVID-19. Going to the next slide. And then in the post-acute phase, a few insights there were tied to post-traumatic stress disorder, but also something they called a mixed depression anxiety syndrome, and there was administrative burden, which also was tied to the very complex matter of taking care of insurances and administrative matters. And then in the quote, you can see, for example, one of the GPs saying, well, after 10 days of running everywhere in the village, trying to save the world, I collapsed and said to my wife, I thought I was having a sort of post-stress disease. I had a lot of difficulty going to sleep because I was hearing the river all evening. I was listening to that river and I was quite anxious. And then with regards to climate grief and eco-anxiety, I think that can tie a little bit to eco-anxiety, although we did see that citizens did not easily make the link with climate change. They rather blamed bad governance for this disaster to be exacerbated. And so here are a few of the challenges, of the response. So in terms of local deployment, it was really delayed, very unsafe working conditions, not enough health workers on the local level, outdated contact details. There was absence of electricity, telephone communication. The focus of support for psychosocial needs is also something that should be reconsidered in these like very high impact events, such as should we really be more concerned about other things next to meeting basic social needs in the acute phase. There also needs to be something done on a quick admission to nearby psychiatric hospitals. Then some other challenges were related to the coordination of response. It's quite difficult to manage conflict in evacuation centers between families and people experiencing mental health impacts or mental health stressors, and also those with substance abuse. Quite, again, staff shortage. And then in terms of the legal, institutional, and protocol barriers, there's quite some barriers that prohibits mobile pharmacies to reach people who are trapped inside their houses in these kind of situations. And it's also institutional, very complex to know who is responsible for what in these first days. And so we identified a few opportunities. Think really needs to be a lot done in terms of emergency warning systems, accessibility of health services. There needs to be more emphasis on small mobile teams, better training. So health workers are better, they're better prepared for these kind of emergencies that we barely ever see in Belgium. And there needs to be continuous education and awareness raising, which is tied to that. And then a few other ones, better alignment, simplified communication. There also a lot of work need to be done in terms of general guidelines Also a focus on the impact of a potential event instead of the likelihood of an event. We saw this also with COVID-19. This might not happen that often, but the impact was immense. And then there's a lot of work to be done to address administrative burden. And then I wanted to wrap up with one slide from the Netherlands. But I do want to highlight, so they did a similar study there and they found nuanced experiences of coping, but which could be tied to maybe positive or socially emotional positive health outcomes, where they saw that the whole experience kind of made many people realize that they need each other, that this is a new opportunity to rebuild their places and their houses. And so quite a few topics should be further investigated, such as indeed focusing also on other outcomes and negative consequences. How can we see social emotional health, positive emotions and emotional competences such as empathy, gratitude, optimism? How can we further research this in the context of climate-induced floods? So yeah, this was a snapshot of our work, and I will wrap up here, and I'm curious to hear from the audience. Thank you so much.
Thank you very much, Charlotte, for this interesting presentation. As I say, these psychosocial health will be how can I say, really an issue of concern for the next decades. And I was a bit surprised by your new phrase on the climate health of the climate migrants. And so I dare say we will have some interesting questions about the climate grief, the eco-anxiety, which you also mentioned. And I dare say these are all psychological issues under these climate challenges we will experience in the next decade. So this is really an interesting point which you here make in your research. And before we discuss your presentation as well, I would like to hand over to our last speaker in this session, to Felipe Laurie from the University of Talca. He is professor of Enology, as we say in Germany, and he is the director of the PhD program in agricultural sciences of the University of Talca. And his research focuses on beverage chemistry and wine production. Chile, a lot of wine is produced, and so wine production is a real agricultural issue for the economics of Chile. And he is particularly interested in the study of phenolic compounds in chemical and sensory effects of oxidation of reaction in wines. Oxidation reactions in wines is an important point also for the long-term storage of wines, for the survival of high-quality wines and so forth. And he will give us a presentation on wine production in Chile under current environmental and sustainability challenges. So Felipe, thank you very much also to you for participation in this session, and I hand over to you. We cannot hear you. Micro. Presentation is visible. Now you are here.
And is the presentation mode on?
Yeah, okay, it's okay.
So thank you very much for that introduction, and good afternoon to everyone. Thank you for having me as well. The lecture will be divided into 4 sections, covering aspects of wine territories, the business of producing wine, the challenges from an environmental and sustainability point of view that this industry is facing, and a few examples of the kind of research that we are conducting at my laboratory. In this image, you can see, well, most of you probably know that Chile is a very thin and long country. We have about 4,300 1,000 kilometers in length. And that provides us with many different climates and different terroirs. Most of the rain in this part of the world is concentrated in the winter time. And this is pretty good in terms of producing grapes and wines. The climate is desertic in the north. We have the most arid desert in the world, the Atacama Desert. Temperature in the center, and used to be classified as rainy in the south. And I say this because we are facing already our 13 or 14, depending on the measurements, consecutive year of drought in the country. And this is particularly relevant in the central part of the country, with most of the agricultural sector and the wine production sector is located. In terms of topography, we have a set of important features that influence the weather that we are going to experience in different cities and places in which we grow crops and grapes in particular. And these are the coastal range near the Pacific Ocean, the Central Valley, in which most of the cities and most of the agricultural sector is located, and the huge Andes mountains towards the Argentinian side, towards the right of that image that you're seeing. These features determine that, for instance, we're going to have cool winds coming from the ocean in the mornings, and we're going to have fogs in the coastal valleys of the country, which is really good for producing white wines, for instance. And we're going to have cool winds coming from the Andes at night, and that will help cool down our cities and cool down the valleys in which we produce grapes and other crops. That generates a significant temperature oscillation that in summertime, for instance, we can have maximum temperatures of 35 degrees Celsius, and at night we could perfectly have 12, 14, 15 degrees Celsius. That much of a difference we can have. And this is also particularly favorable for producing some types of crops, and in particular vineyards. In terms of soils, we also have a huge variation depending on where we are within the country. In the northern part of the country, we have soils that have plenty of limestone, gravel, and salts. In the center of the country, they're very rich in organic matter, alluvial soils, and in the south, they turn into volcanic soils. And all this climatic, topographic, edaphic variation offered us a super exciting set of terroirs in which we can produce fantastic wines that unfortunately are at a high risk due to global warming. In this map, you can see some of the viticultural areas of my country, and these areas in which we produce grapes span from parallels 28 to 40 south, and they're moving towards south because of less rain in the center of the country, because higher temperatures in the center of the country, and some producers of grapes and wines are moving south, trying to escape from this changing scenario. One thing that I forgot to mention is that this is not only an economical issue, and we're going to see a few numbers in a little while. This is also part of our cultural heritage. Wine is produced in this territory that we now call Chile since the Spanish conquest America in the 16th century. And we're even exporting wine from this territory to Europe since that time. And so it's something that is really related to what we are as a country. Now, in terms of organization, of course, we have different appellations, different valleys and sub-valleys from which we produced wines. Let's review a few numbers quickly about the wine business. The surface of grapes we produce is what you're seeing there, above 130,000 hectares. But 70% of that, more or less, is red varieties, Cab, Merlot, Carmenère. And the main white varieties are Sauvignon Blanc and Chardonnay. The total wine production is the number that you're seeing there. 1 billion liters of wine per year, and about 70% of that, please pay attention to the number I'm saying now, 70% of what we produce is exported. So you're probably figuring out already that as I said before, this is not only a problem of our cultural heritage, but also a problem, an economic problem. This graph is showing the evolution of the wine exports in terms of value in orange and in terms of volume in blue. And as you can see, we have reached a plateau of about 900 million liters of wine exported every year, with about $2,000 million in returns per year. So for a country with an income like the one we have in Chile, this is quite a relevant industry also in terms of economical revenues. Chile is the 6th or the 5th, depending on the year, main producer of grapes and wine in the world, and is the 4th larger exporter of wine, with about 9% of the total wines exported per year coming from this country. So let's discuss a little bit about the challenges now. And this is quite scary for those that we live in Chile, but projections of climate change are really bad for us. We are going to see average annual temperature variations of about 1.4 to 1.7 degrees Celsius more by 2050. We're seeing more and more days with temperatures above 30 degrees Celsius, particularly in the Central Valley, again, in the central part of the country, where most of the agricultural crops that we produce and most of the vineyards and wines that we generate are located. And this is bad news, of course, for the quality and for the possibility of producing these crops in the Central Valley. We are experiencing droughts. As I said before, we're in the 13th or 14th consecutive year of drought, and this is supposed to be out of the projections that specialists do, even worse in the future, with 40% more drought frequency than what we're experiencing now for the next couple of decades. And in terms of rain and snowfall, same thing, 16 to 17 less accumulated rain and 50% less snowfall is what we're supposed to be having in the next decades. And that's pretty bad news also in terms of the availability of water, of drinking water, not only water for to provide to our agricultural crops for irrigation, but water for human consumption. And we are experiencing problems with shortages of water in some communities in the north of the country. Global warming is also affecting the pressure of some pests and diseases that we didn't used to have in our country before. This was a real paradise for producing grapes and wines, because we only have a bunch of pests and disease that could complicate our production. And you can think, of course, that determined that the need for using pesticides was much lower in the past than what we're having now. So besides of global warming and the pressure of diseases, we have many other challenges becoming more sustainable, mechanization and automation, trying to look for better sites in which the quality of the grapes and wines that we're producing could improve, or we can conserve the kind of quality that we have. We have to train better our workers, generate better sources of energy. And here's a little list of some of the local solutions that we're implementing in our lab. As it was mentioned before during the introduction, in my lab we work with wine chemistry fundamentally, but we also are trying to provide some tangential solutions to these kind of issues. So for instance, we are studying and developing new forms of phenolic fining. What this means is that traditionally some substances could be added to wines to improve the way they feel, the sensory attributes of these wines. And traditionally, these have been from animal sources. So what we're doing now is to provide studies in which we're using or testing sources of plant protein and residues from which we can have these materials to be added to the wine. We're testing quinoa, we're testing kiwicha, we're testing grape seeds, we're testing malt bagasse from beer. And here's an example of a recent paper that we published with quinoa with this type of clarifying agent for phenolics and for improving the quality of wines. We're also working on mycotoxins removal. The pressure of fungal diseases that we can have in grapes determines that we also may have increasing levels of toxins generated by this fungi, and we could use some clarifying agents, plant-based clarifying agents, or those obtained from residues, to remove part of these toxins that we're finding in some wines. And here are a couple of examples of papers in which we have dealt with that issue. A new project in which we're involved has to do with trying to go away from wine barrels, from oak barrels, because many people, including me, consider that not to be a sustainable way of work. And instead of working with oak barrels, with oak alternatives, we are studying the use of pruning residues. Every year, some crops, including vineyards, have to be pruned, and the shoots after the pruning are either just released or some people try to convert them in compost. So we're suggesting that they could be toasted the same way we do it with oak wood, and that could be used to improve the quality of wines. We're also working with ripening under a global warming scenario, ripening of grapes. We're also working with solutions for automation of winery processes and trying to save energy by doing that. And in order for this industry to keep flourishing, I'd say we have to keep the focus on these kind of issues and becoming more and more sustainable. And in order to do that, I would say that wineries in the future should consider things like the ones that are listed in this slide: CO2 capturing, less barrels, green energy, valorization of wine residues, and more automation and digitalization. And that would be it for me, because I'm way past the deadline you suggested. Thank you.
Yeah, thank you, Felipe, very much for this interesting presentation. I hope there are some wine specialists in the audience for further questions. Now we have done our 4 presentations. We have time enough for discussion. And now I would like to open the discussion. However, from the chat, yeah, Andrew Gall, I guess. Can you see these questions? For Felipe, in the pie chart showing the export percentages of wine per country, the USA was listed twice. Why is that?
I didn't notice that, and it's probably a mistake. The US, it's an important wine producer. It should be ranked in the 4th place, if I remember right. But in terms of exports, it's not that important. And it's not that important because the Americans drink a lot of wine, and there are a huge population of people. So yeah, they are not one of the main exporters, but they are certainly one of the main producers.
Okay, I would like also directly add to this point. So a question from my side, you mentioned the increase of diseases. Isn't it also an issue that due to the mass production of wine, which you have in Chile, with particular focus on Cabernet Sauvignon, Merlot, Chardonnay, which are really grapes, red and white wine grapes, which have a huge amount of production. You mentioned this. And do you think that this kind of mass production on wine under the threat of global climate change should be decreased and adapted more to a diversity of other grapes which you can use with regard to a kind of diversification? Because it is the same if we have everywhere in kind of monocultures, the diseases are always then the winners in the end. So can you give a statement to this point?
Absolutely, you are absolutely right, and some people, scientists, including me, we've been pushing for this issue since long time ago. In the world, and in Chile in particular, the number of vineyards that are becoming or have become organic, that have been included in the code of sustainability and sustainable practices in our country, it's increasing every year. There are some biodynamic wineries as well, vineyards, sorry, in the country. But the thing is, regarding the number of varieties that we produce, we have hundreds, as it happens in any country. The thing is that people don't drink them, and we're exporting 70% of our wine, as I said before. But people in the UK, in China, and the rest of Europe, in the US, where we export the most of our wine, only want to drink Cab and Merlot and Sauvignon Blanc and Chardonnay. And so we have fantastic wines from another varieties, but people just don't buy them.
This is really an issue which the people need to be trained. Yeah. This is a hard job, because now we have exactly this change in several countries around Europe, where the wine producers started to in a kind of sustainable management, ecological management, and so forth and so forth. But as it is always, the prices rise, but nevertheless the quality has risen much stronger. And this is a question of convincing the consumers. Okay, I see another question on the chat from Yvonne. Interested in the climate anxiety. It can spark a willingness to chance, but it can also overwhelm and lead to the opposite. How can we manage it best? Charlotte, are you still in the audience?
Yes, I'm here. But I'm reading the question. It can spark a willingness to chance. Would that be change? But it can also overwhelm and lead to the opposite. Yeah, change. Okay.
Change. Okay.
Yeah, I think currently the response to how can we manage it best has not yet been found, I would say. That's I think it's an ongoing, it's a topic of discussion right now. I think what what mostly been put forward as coping mechanisms is to indeed provide opportunity for people to talk about this, so that there's spaces to share these kind of new anxieties that revolve around climate change. I think that is like one important aspect. And but you're totally right that also talking about climate change can also lead to feelings of being more overwhelmed. So it's a slippery slope there. And it will really kind of depend almost from person to person which approach would work best, as we see with many, I mean, with like how support for mental health is not like a one fit for all, but is often a very personal trajectory for everyone. But I think there's a, and for example, like one of the aspects that like while we're doing these presentations and other events, what came up as well as, for example, people like transgenders gave the comment that some people in our society already have like a higher mental health burden due to other things, and then add this to the mix makes it even worse. So we need to like make sure that we support those who already feel distress due to other causes, that we provide additional support for them. I think also it should be, I mean, the awareness among health workers, not only psychologists, but also especially the primary caregivers. There should be awareness that this can happen in their patient population. So I think we should also really set in on increasing awareness and education for health workers, so they know that this can actually happen. And then in the case of these sudden events such as the floods, I think in the emergency response there should be programs that actively work on this, so involve psychologists who, I think it should be important that they know the existence of this and they can ask impacted citizens about it. So these are a few options that have been put forward, but it's definitely a space that is currently being researched. So no definite answer yet.
Okay, thank you very much. I see another question again to Philippe from Wernigerode. You said that people are blaming the government instead of climate change. Do you mean that in your research you have not noticed more climate awareness, which could be related to recent climate-induced floods? Hey? A question to Charlotte. Sorry, this was a misunderstanding.
Yeah, interesting point. I would say, so we're still in the pilot phase of this study, so we have only interviewed about 15 to 20 people right now. And I must say, many of the citizens we interviewed did not easily make the connection with climate change, which also has to do that it's still only in the most recent years that this connection is really made in the western part of Europe, mostly been said to happen in other areas of the world. But now in recent years, we start to see it a bit more. So this awareness is like growing, but we definitely saw that there was like people were surprised that this was also already related to climate change. Like this connection was not ready made. But for example, with the health workers, like involved GPs, that was like another story there. This connection was more made. So it kind of depended a little bit on who we interviewed, but especially the older population, the older citizens did not make that connection, no. And then maybe one little bit about blaming the government. What we did see, when we did the comparison over the different regions, is that, for example, in the Netherlands, as you saw my last slide, there were also positive connotations there with the floods. But what was also the case there is that flooding mechanisms or like preventing floods is something that the government there is more experienced with. And so they already, how to say this in English, like the dams of the river, there were already like protection measures in place. So the flooding didn't have that big of an effect on the citizens that were living close to the area. You can also see this in the mortality numbers and the health impact numbers from the Netherlands. So, and then for the case of Belgium, the decision to evacuate or not is being made on the local level. And so the communities where evacuation did not happen in an early stage, there the damage was obviously higher. And also I would say the long-term psychosocial effects, there's also a higher chance, because we know that if your exposure to this event is higher, the trauma also increases. And so in that regard, there were quite some complaints that the government did not step up in time to warn citizens to evacuate.
Okay, thank you, Charlotte, very much. I see, is it your question? No, at the moment not. I would like to address a question to Anjali. Is she still in the audience? Yes. When you mentioned in your talk the under and over nutrition, and you also said malnutrition, just for understanding the two definitions, do you address malnutrition in the same way as a synonym to overnutrition in your talk? I'm not quite sure whether I understood it well, mal and overnutrition, but the core of my question is the demographic transition. We have in most countries all around the world this demographic transition. And when I remember the graph which Mats presented in his first talk about the Human Development Index, and he said in order to decrease the ecological footprint on the one hand by increasing the Human Development Index to get down from the exponential curve. What is your opinion to the contribution of this demographic transition? Because I dare say, as a non-expert in that regard, the demographic transition will even enhance this Human Development Index. So I dare say this is a contra-working force in order to get this exponential curve down. What is your estimate about this?
I totally agree with you. I mean, with the demographic transition, where we now see more of a population with higher proportion of people with older age groups, and who have the more likelihood of facing most of these non-communicable diseases with further increased health cost and indirect effect on several other aspects of sustainability, it would be hard to focus on demographic transition and work on an intervention to address the increasing ecological footprint that would contribute from this demographic transition. And for your first question or remark about malnutrition, malnutrition is actually a term which actually encompasses all forms of undernutrition, overnutrition, and micronutrient deficiency. So far, particularly in low and middle income countries, malnutrition was used as a synonym to undernutrition. So whenever someone say malnutrition, the immediate thought would go to undernutrition. But in recent years, that is not the case. That's why malnutrition now should be focused from the context of all forms of burdens, not just the undernutrition. So yeah, malnutrition encompasses everything, and one of the, or like few of the important factors that are driving this shift from undernutrition to overnutrition which compasses malnutrition, are nutrition transition, demographic transition, and epidemiological transitions. Yeah.
Okay, thank you very much. I see one last question which I have overseen from Yanni. And after this question, this is a question to Philippe once again. Alexandra would like to hand over for this networking event. So I just cite the question and then I will hand over the micro to Alexandra. The question to Philippe is, what is the contribution of wine production to deforestation and soil erosion in Chile? And what solutions are being considered to achieve sustainability?
This is probably an easy one, an easy answer, because I don't know. That's the answer. I'm sure that the wine industry have affected and has contributed to deforestation in the search for different places in which you can have more and more diversity and things that are new and that can be commercialized at higher prices. Vineyards and wineries have established it at the Piedmonts of the coastal range and the Andes, and that I'm absolutely sure that it has resulted in this deforestation. How important is that in terms of the whole surface that we have in the country? I don't know. And I would say that the main contributor to deforestation in my country is the forest industry, because they have all the diversity that we used to have. Most of that is converted now, except for national parks and protected areas, into pine trees. And in terms of erosion, in vineyards that are grown at the Piedmonts of mountains, the wineries try to solve that by using cover crops, which are annual crops that are grown in between the lines of vines, and that protect the soil at these different steeps from significant erosion. That would be my answer.
Okay, thank you very much, Felipe. Now I would like to hand over the micro to Alexandra.
Thank you very much for your interesting inputs. And in ENLIGHT, we also connect this lecture to a networking event. You can find the link in the chat. Once you are in our digital platform, just go through the entrance door and turn to the left. You will see their sitting corner and go there. If you want to join the discussion, just hit the space. So I'm hoping to see you there. Thank you.
Yes, I would also like to thank you all for your contributions. Thanks to the audience for the interesting questions. And so I wish you a very nice Christmas time, because next week we will have no session from the liveScience project. So this was the last before Christmas, the last in this year from my side. So thank you very much all, and I hope you have a pleasant holiday, a recovery, for some recovery, and a very nice, good and prosperous New Year 2023. Thank you very much for your participation and engagement.
Thank you.
Thank you.